This is the big year for us, I think, is the 2014. I'm sure everybody's heard about the exchanges. Um, I was on one this morning about 4:45, trying to take those early morning. If you have anybody looking at exchanges, the advice right now when you go to healthcare.gov is try off-peak hours. So hopefully you can get in, it'll work. The deadlines have kind of changed a little bit, but the original open enrollment was intended for October 1st through the 15th of December for a 1st of January effective date. They've extended that enrollment period to next Monday, which is 12/23, for a January 1 effective date. The open enrollment will continue through March 31st. It was originally slated for March 15th, but again, because of the delays on the implementation side, they've extended that out to March 31st for an April 1st effective date. So that's the initial open enrollment. Right now, I think we may see that change yet again because I think we're still seeing some delays in applications. I think a lot of the hope, and I've heard Trish Riley, who used to be with the governor's office on the Bureau of Insurance, she came out last week and talked about they think they're going to see an increase after the holidays where more folks will be focusing back on this provision. And I think federally, if they look at enrollment going down, we may see that extend. The enrollment period would extend through April 1st, and then if you don't enroll then, at that point, you're going to be faced with the fines that we've talked about. But the open enrollment does go on each fall. They're going to run that to coincide with the Medicare open enrollment, which is typically October 1st or 15th through the first week of December. So there'll be an open enrollment each year for folks that want to go on the exchange, and that would not only be an opportunity to enroll if you had not in the past, but to review your options. Do I want to look at another carrier, a different plan option? And those are certainly available to folks. For folks that are on the plan, they do have typical life-changing events during the course of the year that would allow you to make a change. For example, if I had coverage, I didn't take it, I had coverage through my employer, I was laid off, then in July, I could then enroll at that point. If I had an addition in my family, a status change, typical events that we see now in the commercial group market that would allow you to change will also take effect with the ACA. The three carriers in the marketplace, and this is, I think, one of the concerns that I've had, or what I really hoped for when I looked at an open marketplace, is that we'd see increased competition and more companies that would actually enroll on the marketplace. I think it would have been nice to have a regional pool. For me, the idea of really spreading the risk out amongst several states, and again, this is just my opinion, and looking at what we really like to do would be increase competition, open up your risk pool to more people, and then be able to offer some coverages across state lines. In Maine, we've had Anthem Blue Cross Blue Shield that is approved on the federal marketplace. We also have Delta Dental, our folks that are visiting today, and we're going to hear from them in a little bit. Part of the ACA, and I'm not going to talk too much about it, but it does require, one of the essential health benefits is required is pediatric dental and vision. Delta is really, they're our premier dental carrier. We do a lot of work with them. They're a great organization. So for folks, for example, the Maine Community Health Options, which is another option available in the marketplace, they don't provide a dental program. They strictly provide medical. And that's okay for them to be on the marketplace to do that. The government says as long as that there's a qualified dental plan available for folks, then that could be on there. Anthem does their own dental program. So within their marketplace programs, they're going to offer that pediatric dental. As I talk about the dental, and I won't get into too much of the presentation that they're going to do for us, is that for companies that already offer a standalone dental plan, they can basically look to their medical carrier and say, we already offer a Delta dental plan, and the carrier will adjust the rates, again, depending on the carrier, to reflect that. So they're going to see an adjustment. I did one the other day. They were with Harvard Pilgrim. They actually have a Delta dental plan, and Harvard reduced their rates by about 2%. So it was like 1.85%. So that's really what they're looking at for a load, for the rating on that pediatric dental benefit. As far as what the exchanges mean, I can still buy coverage on the open market. The real advantage for folks when they look at what the exchange is going to do for them is that subsidy for the federal government. The federal exchange will allow a subsidy if I make up to 400% of the federal poverty limit. So for example, a family of four could get a subsidy with up to a $94,000 annual income. So again, that's a substantial subsidy. I mean, you can still make a decent living and get a subsidy to help out with premiums. The other side that I always look at with folks when we talk about that is that's post-tax dollars. So a lot of employers are looking at, well, today I pay a certain portion of that benefit for my employees, and then the portion that they pay comes out of their payroll check on a pre-tax basis. So they're not paying federal, state, FICA, and FUTA. For most folks, that's 30 to 32% savings on that dollar. So if I'm paying $100 payroll period for the coverage of my dependents, from a take-home standpoint, that's more like a $70 deduction. Now, if I'm going to buy on the exchange, I'm going to have to pay payroll taxes on that and then buy through the exchange with that subsidy. So some employers are looking at grossing up employee salaries, but then the other piece is if you do that, you want to make sure that they're putting in the new grossed up salary in the exchange when they're trying to figure out their subsidy. So it is an estimated income, and they have made provisions. If that changes during the course of the year, that at the end of the year, I may end up owing more money on that subsidy, or I could potentially be looking at a refund. So again, if they do have a provision looking at that, some of the back end concerns, or I think glitches is a good word, or bumps in the road, is that right now the communication between CMS, the Department of Health and Human Services, and the IRS, they're still really working that out. We've also seen some concerns about reporting between the insurance companies and the federal exchange to make sure that those subsidies are connecting. I think, again, the next couple of months are going to be somewhat tumultuous, I think, in some of those pieces. We're getting a lot of feedback for applications that are having some issues. But once it's worked out, I think the concept should work well, and I'm hoping that we'll see folks take advantage of the subsidies. Oh, and the big one I almost forgot. So as of 14, no pre-existing conditions for anyone. So as you look at the insured pool going forward, I can jump on the plan if I've never had any coverage in the past. Pre-existing conditions have to be covered as of January 1st. I think, again, from what we've seen on a federal level, some of the concerns they have is that folks that are enrolling right now are typically on the older side of the scale. They said the average age was over 50, and I'm very close to that, so it's not old, but it's on the older end of their scale. They're also looking at folks, obviously the folks that are going to enroll and want to get in first are those folks that may have ongoing conditions that haven't been able to get coverage in the past. What they're really trying to target from a marketing standpoint is that young 27-year-old that probably won't use many services to help support that overall pool. And as I talk about taxes, it's going to be cumbersome in that I don't think the tax fee, or they call it a shared responsibility payment. Doesn't that sound better than a tax? It sounds really warm and fuzzy. So the shared responsibility payment was, the Supreme Court ruling came out last summer, the summer before last, and said, yes, they can go ahead and impose a tax or a fee. But as you look at it to the first year, so in 2014, so when I file my 2015 taxes, if I choose not to buy coverage, as an individual, my tax liability is $95. For a family, it's up to 3 times that amount. And it goes through and it looks at, and if we go up through the next couple of years, it increases. But for those of you that see insurance premiums, that tax penalty annually compared to what a monthly premium is certainly not going to make somebody jump on that may or may not need coverage. So concerns again is it may not entice the folks that we really want to get in the pool to help offset those costs as much as we'd like to see that. Fees and taxes, my favorite subject when we talk about this. So the large group mandate, which was supposed to start this year, was delayed for an additional year. I think that's good because we're having quite a bit of issues on the individual plans, so it's nice to see that delay for another year for the larger groups. For many of you that are in the small group platform with the MDA, we did a renewal this year for December 1st. I had 200 and some odd groups that renewed for the 1st of December, and the reason being is that they were able to keep the old plan design for an additional 11 months. This was a twofold strategy that we started talking about with the legal team at Anthem back in May. And it really made sense for our standpoint in that it would give us the older plan designs, which they're saying it saves anywhere from 8 to 14% depending on which plan you're on. And additionally, it gives an 11-month window that we can work out some of the issues with the platform. So not too long ago, administration came out and said we're going to now change that, and we're going to delay the mandate for everybody to 2015. The shared responsibility payment, as they call it on a large group program, and this again goes to my point about, is the tax implication enough? Is it better just to pay the tax or the fee, or to actually enroll everyone? So for a large employer of over 50 lives, the actual tax is $2,000 per employee. However, the first 30 employees are exempt from that tax. So for example, a 55 life firm would only pay the tax on 25 people. Annual tax would be $50,000. For a company of that size, their annual premium is going to be $300,000, depending on their plan and their design and all that. So again, as we look at employers, many may say, we're going to stop our plan, pay the penalty, and let our employees go to the marketplace. Now, employer groups that I'm talking to, that's not their intent. They offer a benefit set to make sure their employees are well taken care of. It's a great way to attract and retain good employees. But as we look at different pieces of the mandate and the cost, some employers certainly will be looking at that. So as we talk about the reinsurance fees, that's a $5.25 per member per month that everyone should be seeing on their fully insured plans now. Self-insured companies will have to pay that as well, so that's another fee that's going in place now. The penalties on HSAs. HSAs are health savings accounts. Probably most of you have seen them, but they're basically like an individual retirement account with a medical card attached to it. Those monies are tax exempt as long as you use them for qualified expenses. However, if I took that money out for a non-qualified expense, in the past I'd pay a 10% penalty and my normal income taxes. One of the increases is this going to bump up to a 20% penalty. So that's a big difference for folks that may need to take that money out for other uses. The FSAs, which is another part of the IRS tax code, flexible spending account is money that you can put aside as an employee on a pre-tax basis to use for unreimbursed expenses. A lot of folks use them for things like their deductible, their co-payments, co-insurance. Maybe I don't have a dental plan. I can use it for my dental, my orthodontic. It used to be that the company could set the amount of money an employee could put aside pre-tax at their discretion. That's been limited as of 2013 to $2,500. The threshold I talked about, the adjusted gross income, I can only write off if I have more than 10% of that. That's a 2.5% increase from what it was in the past.